Hello, my name's David Eyre and I'm a Professor of Infectious Diseases, and I'm going to talk to you a bit more about some of the different kinds of data that we have in the Infections in Oxfordshire research database. So most of the data is in the form of numbers or of categories. So for example, what were the results of a blood test, or what was the specialty of the doctor looking after a patient. To give you an idea in more detail, we might have a record that says on the 18th of July 2016 at 11 minutes past 5 in the evening, a patient went for a blood test, and that blood test was for a particular thing called hemoglobin. We'd have the value, which was for example 111 grams per litre, and we might also have some information about their body temperature, which was 37.2 degrees Celsius, and know that they had a particular infection in their blood called MRSA. And in this way we can write down most of the important details about a patient's health using numbers or categories. Within the Infections in Oxfordshire research database, there's also something called free text data. And this is what doctors and nurses and other health professionals write down or type in their notes. And this kind of information comes from several different things. So for example, reports of scans, when patients have detailed pictures taken of the inside of their body using, for example, ultrasound, CT or MRI, the pictures get saved, but then also a summary of what's been found gets written down. And other times when people give a particular treatment, so for example antibiotics, then the reasons for doing this get written down. And then when a specialist comes to see a patient, so for example an infection specialist, they might write down what they think is going on about a patient. And so in addition to the information that we can get from numbers and categories, these notes help us really piece together the whole story of what's going on with a patient. And this kind of information is becoming more and more important for working out what's most likely to be going on. For example, who's most at risk of getting different infections, and understanding what happens to people who get them. And the NHS tries to capture most of the important information using codes for procedures and codes for diagnoses. But the main reason these are recorded is actually to try and make sure that the hospital gets paid the right amount of money by the NHS, and so they aren't necessarily intended to fully capture what's going on with a patient's health. Now within these free text entries, doctors, nurses and other people writing them are careful to try not to include any details that could identify a patient, like their names. But there's a very small chance, probably less than 1 in 10,000 times, that these notes might accidentally include something that could identify a person. However, it's really tough to get the important information from the report without having the whole thing. So for example, if we're interested in using a report to see who might have pneumonia, a serious lung infection, we could say that we would just look for the word pneumonia. But actually sometimes it might be written that the patient has definite pneumonia, another time that pneumonia is one possibility, or sometimes it's simply written that the patient has no pneumonia. And so if you only looked for the presence of the word pneumonia, you might get the wrong answer. And we're working very hard at the moment to test new and exciting artificial intelligence methods that could help us find a way to get rid of accidental identifiers from patients, and also provide us with really good ways of extracting information that we want to know. For example, does a patient have pneumonia? Because of this, at the moment we're especially careful with free text, and we want to make sure it's used properly. So right now, if a researcher wants to use free text from the database for their research, they need to work for the NHS. And if they happen to come across any personal information while they're looking at the free text data, then they have to let us know right away, because it's really important to keep people's private information safe.